Okay, welcome everyone. Today we talk about very important topics called Addison disease. A lot of people could confuse that. So Addison disease, the way you want to look for it, patient usually present with these symptoms: nausea, vomiting, abdominal pain, and they could have unexplained weight loss usually. Okay, if it's due to prednisone withdrawal, can be weight gain. Okay, so these things that you could, or if it's autoimmune, it's weight loss. So these are the symptoms. So when you have these symptoms and you're suspecting Addison disease, what would you do? The first thing that you want to check the morning cortisol. Okay, so the morning cortisol, what do you look for in a morning cortisol? You look if the morning cortisol is low, then there is a suspicion. If it's less than 1, less than 2, it could be a suspicion of Addison disease. Then after that, what you want to do, you want to see, is it primary or secondary? So you want to check the ACTH. If the ACTH is high, then this could be peripheral. Okay. If the ACTH is low, this is central. Okay, which means the pituitary is not secreting ACTH, so there's no cortisol. So the adrenal glands is fine. Here, the brain is messed up here if the ACTH is low. If the ACTH is high, this means the brain is working fine, but peripherally, the adrenal gland is not working as it should. Okay, so what would you do in this situation? Like, so if you have a primary, which is peripheral, same thing, primary. Okay, this is secondary, they call it as well. Primary, what would you do? You can do other tests. It's called 21 hydroxylase antibody. This is associated with autoimmune adrenalitis. Okay, this to confirm diagnosis of Addison disease. This you could save someone's life. And so we had a lot of patients that they came in with fatigue, weight loss, and they think it's thyroid is abnormal, so they give them levothyroxine, and levothyroxine actually could kill these patients with Addison disease, because levothyroxine can improve the metabolism, but the cortisol is not matching the improved metabolism, so they could go into shock and they may not survive. So that's why with levothyroxine, when you give levothyroxine, you got to give them cortisol. Okay, it's very important. So once you diagnose somebody with 21 hydroxylase, so these patients, so we had that was treated with levothyroxine, and she was experiencing horrible side effects, and her symptoms even worsened. So after doing all these tests, we found out that she had Addison disease, autoimmune adrenalitis. What we did after that, we gave her cortisol, okay, to help her. Usually with adrenal, you give type of cortisol with mineralocorticoid. So after you replace it, okay, well, you have improvement in all the symptoms and all the weight loss, all the fatigue, and all of these symptoms gets better. So we have certain glucocorticoid that have mineralocorticoid activity. For example, fludrocortisone, and then hydrocortisone. These having metabolic mineralocorticoid activity. Okay. Corticoid. If it is central, then you don't need a mineralocorticoid, because ACTH only control cortisol, does not affect the mineralocorticoid part of it. So you can add extra stuff like prednisone, like there are prednisone and dexamethasone. And dexamethasone usually does not have mineralocorticoid activities. Okay, so these are the things. Like these adrenal insufficiency sometimes can be present with sepsis, septic shock. So usually what you want hydrocortisone. Like if somebody is septic, they found out there are a lot of pressors, then you can add hydrocortisone. Like if they're in septic and their cortisol level is low, then most likely they have some adrenal problem. So you can give them hydrocortisone. Usually you want more than 75 milligram in a day. So more than the normal physiologic dose of hydrocortisone. So normal physiologic dose, it's different for each cortisone. So let's say for prednisone, it's around like 4 milligram. That's a kind of match the normal physiologic dose of cortisone. Others like dexamethasone, it's less than that. So you need less than that, like around 0.5 to 0.25. These are the normal physiologic dose. For hydrocortisone, normal physiologic dose is around 15 to 20 milligram a day. Okay, so just make sure, if you, even if the patient have autoimmune disease or some problem, when you want to put them on a long-term cortisone, you make sure not to be more than that, because if you be more than that, this could increase risk for adrenal suppression. So you want it like in the normal physiologic dose, 15 to 20 gram, 4 gram if it's prednisone, 15 to 20 if it's hydrocortisone, or 0.5 to if it's dexamethasone. Okay, so that's the summary of Addison disease. Thank you for listening.